The key thing about this is what confuses me about folks is I can do an MRI on your back, and I can show that you have every disc is protrusion, it's herniated, and the nerves impinged and everything. But if you're not hurting in the area to match the imaging, it's not right. Because there's only an 80% chance that if I cut you open, I find these results. Medicine never guarantees nothing. So you always make sure you treat the patient, not the imaging.
Okay? Right.
You do have a lot of disc protrusions and things like that, but any kind of disc herniation or disc protrusion or foraminal stenosis, any of that would actually cause the pain that radiates down your leg. That's actually called radiculopathy. Okay? And it's related to something pushing or pressuring of the nerve. So the reason why your leg hurts in the morning and then when after walking around a little bit it gets better is that when you're laying down flat, that muscle doesn't contract and release like it should, and it doesn't pull fluid away, so you have what's called dependent edema. And that fluid builds, and then once you get up, the muscle starts contracting, which pushes the fluid into the nerve, which causes the numbness. And once it gets better and the pressure comes off the nerve is when your numbness in your foot goes away.
Gotcha.
Okay? Because this is a model of your back. And in between these two bones, this is the area, is a facet that actually is, if it's arthritic, if it's aging, and you have a lot of it in your back related to the facet joint, and you have ligament flavum thickening, hypertrophy, degenerative joint disease, all of that is related to this spot right here. Okay?
Mm-hmm.
This area, the reason why it's called a joint is actually it can make its own pain. So when you're up sitting, standing, walking, washing dishes, or sweeping the floor, weed eating the yard, this area, this muscle won't contract release. It gets fatigued, so it starts spasming, and it'll cause a pain that radiates from side to side, and you will lean over and you'll prop on things. I call it grocery cart syndrome because you can pick it out of the grocery store real easy. People come in, they'll grab a cart, and they'll hang on it as they're walking around getting their groceries.
Right.
That is all facet pain. Okay?
Okay.
And as day goes on, this muscle or this area will get more tired, so it'll start spasming, and it'll hold on the fluid, and then, gravity will pull everything downhill. So you could be walking along, moving along, and then all of a sudden the pain shoot down your leg. And it's this fluid that's drained into this hole, which goes down and causes the pressure to increase on the nerve real quick. And that's why it shoots down your leg. And also the reason why you feel the weakness is the brain realizes that too much pressure on the nerve will actually hurt it. So it'll actually make your legs, the muscles in your leg, weak because it doesn't want you to allow to contract the muscle to put more pressure on the nerve.
Gotcha. Okay.
Okay. So the key thing about your pain and your pain not hurting a lot down your leg is that with all of this disc bulging and everything like that, and I can't really do the complete exam over the internet, is that you first start off with what's called a lumbar epidural, okay? And you put medicine in this epidural space, and you tend it to go down this hole, and it can help your back and your leg. What I'm really trying to do is to make sure that I've got all the inflammation off that nerve to make sure that you're, more stable when you're walking, your legs feel as strong as they can, and things like that. If we do that injection and you don't have any more of that numbness in your legs, but then your back, 2 weeks later, your back's right back, and it's hurting. And you're like, when I sit, stand, walk, wash dishes, it's just killing me. Then you do what's called a facet injection. And this is what you've been heard since 2017. You should be trying to get this treatment. And the chiropractor, the more you pop it and stretch it, the weaker it'll get, the more fluid will hold to it. You'll notice that the chiropractic treatments will steadily get worse. You're getting it, and then it just steadily makes your back worse and worse and worse.
Right.
What you do is you actually put medicine in this facet joint, and you see how much relief you get right there when you're up, sitting, standing, walking. If you get 90% relief for 3 to 5 months, then you're able to increase your activity, you're able to increase your range of motion. The key thing is range of motion. Walking's not going to help you. Swimming's not going to help you. Hanging upside down is not going to help you. You got it, because you're already doing everything to make that muscle weak. It's the stretching that's what makes it better. Okay?
Okay.
So if we do that facet and say it helps 90% with the pain when you're up, sitting, standing, walking, but it doesn't last but 2 weeks. Well, one, that proves that we're in the right spot. So then you do a numbing injection where you just numb the area up and see how much relief you get. If you, first injection, you got 80%, second injection, you got 70%, it proves you for what's called an RFL, radio frequency lysis of adhesion. You put a needle back in that same little muscle, you kind of heat it up, you denature the nerve and make it draw back. You don't feel that area in your back for 6 months to 2 years. So you're able to increase your range of motion. You're able to move around like you would, and that makes that area stronger. So then, therefore, you don't hurt in your back.
Okay, gotcha.
Okay, but if you was to told me, Rick, my left leg is numb all the time, I got something's burning in my thigh all the time, then I would be more worried about the disc bulge. And since you haven't had any type of treatments beforehand, you're probably going to be very, you're going to have a lot of efficacy for any dose of steroid. So doing an injection, it may cover all of it. It may cover your back, your leg, and all. And if that happens, wonderful. Leave it alone. If it don't, I'm going to have other treatments to kind of make sure we're going in the right direction to get you better, get you moving. So even though you're 46, you ain't moving around like you're 66.
Absolutely right. Yeah, cause that's how I'm moving now.
But and I mean, it's totally up to you. I could just do the facet treatments that's to help your back pain, but they won't do anything for your leg. The epidural, it could possibly help your leg and your back. So that's the reason why I'm kind of going back to the epidural.
Right.
Up to you.
No,
would you want me just to focus in on your back, or would you want me just to focus in and try to do both? Kill two birds, one stone is what I'd say.
Yeah, I want to use your 25 years of experience as far as what you think is the best. I fix houses for a living.
Okay.
Right.
Yeah, so I really think that we start off here and see, and like I said, if I get you better and you don't need me 2 years down the road, fine, send me a postcard.
Right.
And whenever you do need me, all you got to do is call us back. You don't have to call through your regular doctor. We're treating your back now, so don't worry about that.
Okay, great.
Okay. And do you have any questions for me?
No, so just so I'm clear, so what you're saying is that you're going to you start the treatment, which will allow me to do certain things that will help heal whatever's going on with my back, which is the stretching and all of those things. Am I kind of hearing that right?
So what I'm going to do is I'm going to get you in a position to where if you can increase your range of motion
right.
with Pilates or things like that, then you can actually improve the integrity of your back, and that would actually make your back better.
Gotcha.
And if what I do or what we do here, if we give the injection and you don't do the stretching and physical therapy, then you're almost like a steady plane.
Okay.
You will need the injection. There is people that do one injection and they never have to come and see us again.
Mm-hmm.
And then there's people that do injections and they need us every 3 months. The key thing is trying to get your activity and the range of motion of your back to kind of get better. You don't need me as much.
Gotcha. So so once I get the injection and I start, is it going to be my responsibility to call you guys and say, hey, I think I need it, or would that be just a normal follow-up routine or something?
No, it'd be where you, and I'm going to give you the phone number and the extensions here, because say 4 months down the road, you think you're 18 again, you're wrestling around with some friends, and you pull you back. Then that's when you'd call me and say, hey, Rick, I need another injection.
Okay. But so the expectation from this first injection is that it should, from your experience, give me the relief so that I can, increase my range of motion and my activity that will then kind of help put me on a better track to somewhat normal recovery.
Right.
Okay.
And say if we do this injection and in 3 weeks, you're not having any problems with your legs, but your back comes right back. Your back pain, when you're up sitting, standing, it comes right back. Call me. I can do an injection then to help you for your back.
Gotcha. Okay.
Because what we need to do is after this first injection, we need to break them apart. Your leg versus your back.
Gotcha. Okay. Makes sense.
All right. Anything else?
And you said, so since it's a week off, I got to take some type of pain medicine so that I can work. How many days did I need to not been to taking any ibuprofen before the 8th?
1 day.
Okay.
Yeah, 1 day. And the key thing is, have you ever tried hot compresses, cold compresses, and things like that?
I mean, I put heat on my back and ice pack on my back. Is that what you're talking about? No?
Yeah, the key thing about heat or cold, especially like in the morning when you get up, you're going to want to try to use some kind of warm compress or a warm shower. Don't stay in there longer than 15 minutes. Don't put something hot on your skin longer than 15 minutes. If you do, you'll actually make your pain worse. You put the hot on your back, your brain starts increasing the circulation to that area. But after about 15 minutes, the brain starts worrying about skin getting burnt, things like that. So it'll actually increase the inflammation in the skin. So your pain, you'll get off the heating pad and it comes